Bismillahirrahmanirrahim. In this video, the healing processes, regeneration and fibrosis are compared thoroughly. Following are the references for this video. The wound healing involves both the repair and regeneration. They involve a complex interplay between variety of the cells, growth factors, cytokines, and many matrix protein. These matrix protein are produced or come to the extracellular matrix. And all these lead to the repair, either repair or regeneration. There is no rate limiting step in this process except the uncontrolled infection that stops the process and leads to the improper or impaired wound healing. So in the extracellular matrix, maintenance of the stem cell, their differentiation and the deposition of the matrix are key for healing and fibrosis. The successful healing maintain tissue function and repair tissue barriers, prevent blood loss and infection, but usually if there is extensive damage, it may be repaired by collagen deposition or scarring that is termed as fibrosis. So wound healing can occur by two mechanisms. One is regeneration, another is fibrosis. Whenever there is a preservation of the extracellular matrix, there is probability of regeneration, and there is a scaffold of this matrix architecture that is intact, and proper signaling of that signaling mechanism we are going to study in detail, and these proper signaling is going on along with the preservation of the basic scaffold of the extracellular matrix. When the matrix is produced extensively due to or there may be uh, increased or larger destruction of the tissue, or if there is decreased proteinase activity that lead to fibrosis. So poor healing may result from decreased matrix production, increased proteinase activity, decreased signaling of the growth factors, or altered assembly of the extracellular matrix. The table is differentiating between the two outcomes of the healing. One is the healing with regeneration and another is the healing with fibrosis or scar formation. When there is complete restoration of the tissue architecture and function, that is recalled regeneration. Or when the injured tissue is replaced by connective tissue and there is formation of the scar, that is healing with fibrosis. So in regeneration, the function and structure of the tissue is fully restored, while in fibrosis this is not restored and the structural integrity is regained by deposition of the uh, fibrous tissue, that is scarring. The regeneration is common in tissues with high proliferative capacity such as skin, liver, mucosa and bone marrow, while the fibrosis is common in the tissue that have got limited regeneration capacity, or when there is chronic type of injury. In healing with regeneration, there is involvement of stem cell. These stem cells can be local or they arrive there from the bone marrow, and they derive from stem cell progenitor cell, and they are responsible for regeneration of the lost tissue. The stem cell involvement in fibrosis is minimal, and the fibroblasts are the main cell that dominate the healing process. In the regeneration, the inflammatory process is brief and controlled, while in fibrosis or healing with fibrosis, the inflammatory process is prolonged or chronic. In regeneration, the formation of granulation tissue, that is the collection of some loosely arranged tissue along with sprouting of small capillaries, this is transient and organized, while in healing with fibrosis, the granulation tissue is prominent and it is persistently present due to ongoing process of the inflammation. In the healing with regeneration, the role of the fibroblast is supportive and temporary, while in healing with fibrosis, the fibroblasts dominate. They synthesize collagen and other extracellular matrix. The extracellular matrix in regeneration is temporarily remodeled for integration of the new tissue, while in scar formation there is excessive deposition of extracellular matrix that lead to scar tissue. Myofibroblast involvement is minimal in regeneration, while in the healing with fibrosis it is a key player and causes the wound contraction and deposition of the collagen. Angiogenesis supports regeneration and then regresses as normal vessel form in regeneration, while in healing with fibrosis it may persist abnormally or regress after the formation of fibrous tissue. The functional outcome in regeneration is full restoration of the function of the tissue, while the altered or reduced function of the tissue happens in fibrosis. The common examples for regeneration are liver, skin, bone, intestinal mucosa with intact stem cell niche, and the healing with fibrosis examples are heart, lung, kidney, CNS, and these are the common vital organs that are affected by these fibrosis or scar formation and alter or reduce their function. So this picture from Robbins is showing the normal architecture and effect that are resulting in regeneration and scar formation. If there is mild superficial injury as occurring over here, only the epithelium is damaged and underlying connective tissue is intact, and there is proliferation of the surviving epithelial cells, activation of the basal cell stem cells that are present in the basal layers of adnexal structure such as hair follicle, and there will be restoration of the normal function and architecture such as happens in superficial skin abrasion and mild hepatic injury. Then there can be severe injury, extensive injury that affects a larger area, or that may be continuous. It occurs for a longer period. So if there is involvement of epithelium and underlying connective tissue or altered architecture of the extracellular matrix, there is first inflammation and removal of the dead tissue, a larger granulation tissue and persistent granulation tissue is formed. There is recruitment of the fibroblast, extracellular matrix deposition, myofib then myofibroblast mediated contraction of the wound occur, and scar matures as vessel regress, and there is dense collagen that accumulates over there. But in this type there is loss of normal architecture that leads to functional impairment depending on the site and extent of the injury, and examples for these are deep skin wounds and chronic inflammation. So briefly you can summarize that trigger for regeneration is mild injury or minimal extracellular damage, while fibrosis occur after severe injury or the damage to the extracellular matrix architecture. So there is the restoration of the normal architecture in regeneration, while in scarring of fibrosis there is a replacement by the fibrotic tissue. The major cell players of the regeneration are stem cell, progenitor cell or epithelial cell, while fibroblast and myofibroblast are associated with the fibrosis. Matrix remodeling is temporary and it is replaced by normal stroma in regeneration, while there is extensive collagen deposition and there is loss of the normal extracellular matrix architecture. So functional total function is restored in regeneration, and in scarring the function of that parenchyma or area or tissue that is damaged is often impaired. Thank you for watching this video. If you have any question, please write in the comment box.